Imagine you're a medical coder faced with the task of coding neoplasms. It's vital to navigate the Neoplasm Table effectively. This resource simplifies the process of coding tumors and cancers using ICD 10-CM. The first column details the morphology or site of the neoplasm. The second column describes its behavior, such as benign or malignant. To begin coding, start with the site of the neoplasm, like the lung or breast. The table directs you to the correct code. Next, identify the morphology, referring to the tissue type with unique codes for each neoplasm. Then, determine the behavior of the neoplasm. The table provides behavior codes: benign as 0, malignant as 3, carcinoma in situ as 2, and uncertain behavior as 1. Choose the right behavior code based on the physician's supplied documentation. Another important step is to check the excludes notes within the Neoplasm Table. These notes indicate combinations of codes that are not permissible. Before accessing the Neoplasm Table, consult the alphabetical index first. This will yield the appropriate code range or site, providing clarity for the next steps. Malignant neoplasms are generally prevalent and easier to code since they are clearly listed. Remember to code primary cancers separately from secondary or metastatic types, which have spread elsewhere. Carcinoma in situ or CIS refers to localized cancers. These often receive a distinct code, like D06 for cervical carcinoma in situ. Benign neoplasms, classified as non-cancerous, are coded with 0. For example, a benign skin tumor would be coded as D23. It's crucial to refrain from using unspecified neoplasm codes, unless absolutely necessary. The aim should always be specificity. When dealing with metastatic cases, code for the site of metastasis. For instance, if lung cancer spreads to the liver, use C78.7, not the code for lung cancer. Modifiers should be utilized for recurrent neoplasms to reflect clinical severity precisely. In unique cases like multiple neoplasms, each site needs an individual code. If both breast and lung cancers are present, code them separately. For differing histologies at one site, code both unless a combination code exists. In cases of unspecified behavior, choose the appropriate code while aiming for clarification from the provider. Stay informed about annual updates to the ICD 10-CM codes and guidelines to keep up with new classifications. Continuous education ensures precise coding. Thorough documentation by physicians significantly reduces coding errors. Accurate details about the type, location, and behavior of neoplasms are imperative. When dealing with secondary neoplasms, always code them separately from primary cancers. Focus on the metastasis site, avoiding unnecessary recoding of the primary neoplasm. In summary, by mastering the Neoplasm Table and adhering to these guidelines, you can confidently code neoplasms accurately. Keep your knowledge up to date and prioritize complete documentation for success in medical coding. To learn more about primary versus secondary diagnosis coding, visit the link provided. Also, check the SEER training website for additional resources specifically for oncology data specialists.